we use very high quality ultrasound machines which can take images in 3 dimensions and also measures blood flow to the womb and blood flow to the ovary. This is very important because with natural and mild IVF, every follicle in the ovary counts. As part, in fact, of our fertility MOT, the assessment, we measure the volume of the ovary and the blood flow in the ovary, and above all, we count the little follicles between 2 and 6 millimeters within the ovary. Because if they're between 2 and 6 millimeters, that indicates good reserve, if you've got plenty of follicles at that stage. So that's at an early stage. We will also measure the blood vessels, and these vessels will tell us about the amount of blood flow in the ovary, and that gives us an indication of how good a reserve of eggs it will be and how it will respond to treatment. Now here's the picture of a follicle, and this is the follicle that's about to ovulate. So what we do is monitor with colour Doppler the flow of blood around the follicle. And you can see this is very good flow. So these are the vessels around the follicle. This is the follicle inside, and these are the vessels around it. Some of the original research we're doing now in the unit is we look at the wall of the follicle in 3 dimensions. So we'll be able to tell the difference between cysts and follicles and the different type of follicles that we can see by this 3D effect. And this is a good lining of the womb. You can see it has 3 layers there, and that's a good thickness. So this is an endometrium that's responding to a growing follicle. And we will look at the blood flow within the uterus, and that's excellent blood flow. So the overall flow of blood to the uterus is good in this case. And there's one other thing we will do. We will look at the lining of the womb in 3 dimensions. And you see the cavity is a nice straight top, so it's a good shape going right down to the cervix here. You can see the fallopian tube coming off here. And that's very important because if there's an abnormal shape, if there's a septum or if there's a fibroid making an indentation in it, then that would not be good news. So doing a 3-dimensional scan of the cavity of the womb, the lining of the womb, is very important.